All right, students, we're going to do our first MBLEx quick check. The way that this is going to work, I'm going to read out the question and the answer choices. Now, if you look down below in the video description, you'll find a link to this quiz. So you'll be able to select the answers as we go. Afterwards, you can submit it, and then it will give you your responses, the questions that you got correct, and it'll give you the questions that you missed and your score out of 100. Okay, so they're going to be 10 questions, and this is all material that we have covered this far. So we're going to kind of just see where you are at. So let's get started. The first one is, whose responsibility is it to maintain professional boundaries throughout the therapeutic relationship? Is it A, the client is always responsible for maintaining clear boundaries? Is it B, the practitioner is always responsible for maintaining clear boundaries? Is it C, the state regulatory board is always responsible for ensuring clear boundaries are upheld? Or is it D, nobody, because transference has been a common experience in helping relationships for many years now? Question number 2. What is the only rotator cuff muscle that does not involve shoulder rotation? Does not involve shoulder rotation. Is it A, supraspinatus, B, infraspinatus, C, teres minor, or D, subscapularis? Does not involve shoulder rotation. Next question. The blank is the prime mover agonist, and the blank is the opposing mover antagonist in flexion at the elbow. Is it A, biceps brachii, prime mover, triceps brachii, opposing mover? Is it B, triceps brachii, prime mover, biceps brachii, opposing mover? Is it C, biceps brachii, prime mover, brachialis, opposing mover? Or is it D, triceps brachii, prime mover, or brachialis, opposing mover? Question 4. The practitioner begins to feel sexually aroused during the massage treatment and becomes self-aware during subsequent massage treatments that the practitioner is still fantasizing about this client. What would this be considered? Is it A, transference toward the client, B, countertransference toward the client, C, autonomy because the practitioner is self-aware, or D, the result of the power differential that exists between the practitioner and the client? Question 5. What muscle acts as a synergist to the infraspinatus in lateral rotation at the glenohumeral joint? Is it supraspinatus, B, subscapularis, C, teres minor, or D, none because the infraspinatus acts alone? What muscle acts as a synergist? We need to know what this is. A synergist to the infraspinatus in lateral rotation. This is the action. Supraspinatus, subscapularis, teres minor, or none because the infraspinatus acts alone. Question number 6. Your client tells you, I feel terrible pain all the way down my right leg, especially when I move from a sitting position to a standing one. The pain increases significantly. What type of treatment information would this be considered? So we're talking about SOAP notes. What type of information would this be considered? Is it going to go under A, subjective, B, objective, C, assessment and application, or D, planning? So your client tells you, I feel terrible pain all the way down my right leg. What type of treatment information? Next question. All of the following are examples of symptoms, subjective evidence of disease or bodily disorder, except A, pain on a scale of 1 to 10, B, body chills and aches, C, fever of 101.3 Fahrenheit, or D, dizziness. All of the following are examples of symptoms except which one is not a symptom? Next question. A client comes to you with pain in their upper arm, below the shoulder, and above the elbow to be exact. Which description would correctly describe the location of the client's pain? Is it A, the client's pain is cranial to their shoulder and inferior to their elbow? Is it B, the client's pain is more medial to the shoulder than lateral? Is it C, the client's pain is distal to their elbow? Or is it D, the client's pain is proximal to their elbow, below the shoulder and above the elbow? Which one of these is the correct description? Number 9. Which type of contraction would only cause the muscle fibers to shorten? Is it A, a concentric contraction, B, eccentric contraction, C, isometric contraction, or D, an isotonic contraction? Which type of contraction would only cause the muscle fibers to shorten? And then last question. Which muscle tissue is striated, quadrangular, and controlled by the autonomic nervous system, ANS? Is it skeletal muscle tissue? Is it smooth muscle tissue? Is it cardiac muscle tissue? Or is it all of the above? All three of these. Which one is striated, quadrangular, and controlled by the ANS? Now remember, there's a link down below where you can take the quiz and receive the responses to the questions. I would highly encourage you to know this material before going into the MBLEx. It's very, very important that you know this stuff. If you're having trouble with any of these questions, down below I will also add a link to each one of these questions. So it'll go 1 through 10. If there was a specific question that you had trouble on, you can click on that link and it will lead you to the video talking about that particular topic. Again, make sure you know this stuff. It is likely that you will see it again when you take the MBLEx. So it's very, very important that you know it. As always, feel free to reach out to me. Let me know how you did on your quiz, and I will see you in the next video. Y'all take care.